right, with that, we'll move to the next session. Robots ate my job. The doctor will see you now. So that's a nice, interesting session. Basically, from envisaging the role of robotics in health tech to building smart hospitals, how is technology disrupting healthcare and what we do, what we have in store. So the huge focus of industry experts is on innovation and research to develop affordable and sustainable solutions to improve healthcare. Dr. Rahul Jain from Belle Vue Clinic will be leading this session. He is a qualified diabetologist, and this is the second session in the same room with him, so welcome again, sir. He is a cancer survivor and a left leg amputee. His clinic offers one of the best treatments in diabetic patients, and he ensures that he treats conditions based on patients' symptoms, duration of illness, and all other complications that go along with it. He was the first doctor to detect an outbreak of chikungunya in the city about 35 years back. With that, I welcome Dr. Rahul Jain.
Thank you for that very kind introduction. And I'm here to tell you about a few of my experiences that I've gathered over the years working as a doctor. I don't have a tech background like many of you here. A few weeks ago, I had a very interesting eureka moment when I was overdosing on popcorn and Coke. So I often get dragged into cinema theaters by my son. Next slide, please. And there's this wonderful animation cinema I saw. It's called Spider-Man. And one of the central themes is that there's this sort of a super villain, a kingpin. He's called Kingpin, and he drags people from different universes, from different timelines together, and they come together in something what is called a multiverse. And I thought, and I scratched my head, that are we in India living in a multiverse? The reason I say that is we've got such different languages. We have such different areas of expertise and levels of, as to how much technology has been embraced by the different hospitals and doctors. And obviously not everyone has the same standard protocols. Not everyone has access to the same kind of technology. And therefore, India is in a way, because of its varied ethnicity, languages, it's like a multiverse, and different people will have different kinds of treatments as far as medicine is concerned. The next slide, please. So that brings us to the preamble of my topic, robotics. The robots ate my job, and I can assure you I'm nowhere going to go for the next at least 30, 40 years. I'm going to be very much here. So there is this entire talk, this entire juggernaut about robots taking over human jobs, and a study which was done has shown that new robot can perform, if well-trained, can perform a surgery 50 times faster. And faster obviously means cheaper, and cheaper means better. And robot doctors are set to, the healthcare industry. There's a lot of talk that because of the innovations of robots and artificial intelligence, a lot of medics and paramedics will be losing their jobs. That's what a brief was to me to speak about. The next slide, please. So, which brings us to a very important question, that how much is robotics ever going to be implemented? Now, we have a traditional learning curve for doctors. They train first in their residency, what we call MBBS in India, and they undergo supervised training for 5, 6, 7 years. This is followed by internship, housemanship, and of course postgraduate degrees. And you need to have a certain level of expertise, a certain level of accountability before you can actually touch, and you are actually qualified and you're licensed to treat patients. Now, it's very important that we touch upon this particular topic at the outset, because you need to hone certain set of skills before you can actually treat patients or take decisions based on the patient's data. And this is important because unless we have a certain degree of credibility, a certain degree of accuracy, you cannot be treating human lives. This is very important. The other thing which comes to my mind when you have the prospect of a robot taking decisions for human lives, is how credible is a robot? Do you have systems in place which can actually gauge the credibility of robots? We have exams, we have viva voces, we have ward rounds, but do robots who are, say, for example, have got the approval, or they will be applying for approval for handling sensitive patient data and patients? Will they be able to take decisions independently without human supervision? To my mind, it is not yet it's not ripened enough to fruition. Of course, we are getting there. Having said that, I'm not averse to any kind of technology. In fact, there was never a time any of us in this room could say they can live without technology. I was born on the 9th of August 1975 when Doordarshan was first, came to Kolkata. So obviously technology has taken us a very long distance. However, there are a lot of do's and don'ts which we need to keep in mind before we can sort of fully integrate robotics and artificial intelligence without any kind of human supervision into hospitals. The next slide, please. And one of the stories I have grown up reading as a child was the Jataka tales. If you know the Jataka tales, it's about the previous lives of the Lord Buddha, Sakya Muni or Bodhisattva. Now, this has got a very important parable in artificial intelligence, is that what is artificial intelligence? What is deep learning? Now, basically, deep learning means that you acquire data, thousands and lakhs of hours of man-hours of data, and you incorporate it into various different trends based on patient symptomatology, and the collective wisdom of this data translates into deep learning. Human learning digitized and stored in machines, which can then look for patterns which are visible and which are not so easily visible, and to collate that data and use it for diagnosing illnesses. Now, the Buddha had 32 lives, it is as per the Buddhist canon, and he remembered the experience of all the 32 lives. That is why he was so wise. This is just a parable. So, a machine which does deep learning also collates thousands of hours of data and processes it for use that can be used in the treatment, the diagnosis, and the decision making in the patients which they encounter. The next slide, please. And of course, so one of the first, childhood concepts which you have when you compare the human brain with that of a computer is, of course, Chacha Chaudhary. The next slide, please. So all these, we've grown up seeing all these things. Now we think of a robot as something sitting on the back of the doctor, and it for many people who are very afraid of technology, I must confess that most doctors are not very familiar with the technology, although they might be using the work of engineers for their day-to-day practice. But how we go about this monkey on the back is how you treat it. Now you have to treat it as a partner. The next slide, please. And you have to use technologies when they are used in different proportions. Now, this is very important because you take the decisions yourselves, and hospitals and healthcare systems will use electronic health records. They will use artificial intelligence to help predict diseases. Use it, for example, use the automation which robots offer. For example, sending you images to your phone or to your handheld device to help you organize, retrieve, and archive data which you can easily do with your phone. Now, it's very, very easy. Set appointments, set cancellation messages, and this is important because this saves your precious time. Now, what kind of implementation you will want to have in a particular patient will depend on the comfort, the expertise, and the acceptability of a doctor and a hospital or to a set of hospitals or to a set of healthcare providers, so that it can be implemented in the, you can use all the blue, all the white biscuits or all the brown biscuits. It completely depends on your level of expertise. And it's very important for IT professionals like you and business entrepreneurs like you that all the hospitals I see envisage in the coming future will have robotics and artificial intelligence as an add-on. Now let me try and explain and quantify what I mean by an add-on. It's a product to sell another product. So you might be having, for example, XYZ hospital. We have the latest artificial intelligence, we have the latest gadgetry and automated lab systems. Now, this may not be of immediate concern to a person who walks in with a chest pain for a possible treatment of a heart attack, but you know that name sounds like a good product, something which is innovative and something which is fresh and something which is up to date. Now, that sells another product, which is the treatment of something else which is not directly or related to, for example, a chest pain or any complex surgery. The next slide, please. Now, the ancients of yore have tried very hard to find patterns and to predict the future. Some have used, like in China, they use tea leaves. They read the tea leaves. Some people look at goldfish. Some people look into crystal balls. All I can say is that we have a large repository of data which we are storing in paper. Now, paper is, by and large, will be dark data. You can never collate it. You can never use it for helping the generation at large. Now, if it is made mandatory for electronic health records to be kept for every patient, and you can collate the symptoms, you can, tally all the symptoms together, and IT companies and entrepreneurs like you sitting there, not people like me, I am from the medicine background, have to find simple electronic health record systems in which they can collate the data of thousands and lakhs of patients and use it for the betterment of more and more people. The next slide, and you can get a full picture. It's a wealth of data mining which can be done. The next slide. And it's important for us to realize that we are very less aware of what we don't know. So we think we have AI, we have robotics. The human body is extremely complex, and let us not fall into the trap of thinking that there is a treatment for any and everything possible. It's very difficult. As you learn, all of us learn more and more about the advantages and disadvantages of technology, we will realize that the human body is extremely complex. The next slide, please. And in a place where you have, in a country where you have a debate about almost everything, the color of people's clothes and the length of ladies' saris and the rafale and blah, blah, blah. So you'll have a lot of talk about, you'll have resistance from all quarters, what you want to implement, how much you want to implement. Somebody might say, okay, we can buy 1 billion samosas for the price we paid for that statue of, unity. So all these things happen, but it is for the industry to find ways and whereabouts whereby data can be used, robotics can be used for healthcare at a relatively affordable cost. Of course, unless you use it on a larger scale, you're never going to have robotic surgery or robot-assisted surgery or artificial intelligence systems which are going to be cheap unless it's implemented over a large number of patients and hospitals. The next slide, please. We've got, till now, the journey has been quite encouraging. We've got actually US FDA approved devices which can detect diabetic retinopathy. The next slide, please. And this has reduced conventional time required for ophthalmologists to find out how many patients are actually need to be properly screened by the humans for diabetic retinopathy. The next slide, please. We've got this artificial pancreas, which uses real-time artificial intelligence. It uses algorithms to find out how much insulin needs to be injected, how much insulin needs to be given in bolus, basal, what is the dose of glucagon which needs to be given to prevent hypoglycemias and prevent high blood sugars and low blood sugars in patients with diabetes, for example. The next slide. Facial recognition is, of course, coming up in a very big way. Imagine walking into a hospital and being recognized, your appointment, everything ready. By the moment you walk in, your face is scanned. And you don't need, useless human hours to be wasted on something as mundane as recording a patient's when a patient walks in. The next slide, please. We have this entire story about the Da Vinci robot and how it is useful. The Da Vinci robot systems are, again, systems which can be used in a large number of patients, and they actually reduce infections because the surgeon is staying away, very far away. You get a 3D stereoscopic view. The next slide. And what is most important is the robotics, because they don't have the human anatomy. It's the wrist of the Da Vinci robots. They can be maneuvered in any direction. Giving stitches, handling tissues has become much, much easier. Of course, it comes with a huge learning curve. Ideally, the learning curve should come from the medical college itself. If the policymakers are listening, perhaps they should introduce more robotic systems into the medical colleges when doctors are being trained in their surgery disciplines. The next slide, please. Of course, this is another computer guided. It's like a snake. It can perform heart surgeries through a very, very small port, and thereby minimizing the chances of wound infections and also reducing the post-operative complications by a very, very big %. Because the humans are very far away, the chances of developing infections are much less. The next slide again. We have this artificial, eye knife which we have, and the eye knife is another robotic device which analyzes in real time whether the tissues you're cutting are cancerous tissues. Now, on-the-spot spectrometer is built into the exhaust of the eye knife, and you can actually see whether you're cutting normal tissue or you're cutting cancerous tissue. Imagine how good this would be. Redo surgeries are, okay, I've left a part, when you cut a tumor, one margin of the tumor is positive for cancer cells. You have to open the patient up again and redo the surgery. Now that is ridiculous. So we can prevent such unnecessary surgeries, redo surgeries by using such simple devices. The next slide, please. Again, we've got robotics and artificial intelligence, which is slowly coming into something which can be easily digitized and shared, such as X-ray radiography, CT scans, PET scans, and MRI scans, where a computer can analyze whether what we are looking at is tumor or healthy tissue. The next slide, please. I think the end-all and the be-all, the final frontier of any system would be to have an automated robot which can take decisions for itself. At this present moment, it looks like a distant dream, but we have to keep innovating and we have to keep trying. The next slide, please. I think I would like to end with a Shubhashitam, and it goes like this, that the lion does not need a Rajabhishek or a coronation. It is a king of the jungle, and if a particular technology does well, innovates well, and serves more people, it is a lion. It doesn't need any coronation by you and me. The last slide, please. So I would end my talk here. Thank you very much. If any questions?
I think we're running short of time. The next panelist actually have to go. Just 1 minute. Just 1 minute. So thank you, Dr. Jain, for such an insightful talk. We just hand over a memento from NASSCOM as a token of our appreciation. Atulji.
Thank you for the appreciation.